Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Welcome to a very special episode of the Dental Brief, fastest podcast in the dental community. I'm very pleased to have with me and excited to have with me today Dr. Stephen Olmos. Dr. Olmos is the founder of the TMJ and Sleep Therapy Centre International. Dr. Olmos, go ahead and say hello.
Hi, Patrick.
We're so glad to have you here. You've done some amazing things in the dental industry, specifically when it comes to building the TMJ and Sleep Therapy Centre International. Why don't you tell me how you got into dentistry, and then go ahead and tell me how you got into sleep and TMJ, and then how you founded the center.
How I got into dentistry, I think I was 14 years old when I was looking at career choices and decided that would suit me. I thought I was pretty good with my hands and thought process and wanted to help people. When I became a dentist, I saw that there was a whole group of people who were in chronic pain that nobody ever seemed to know how to help. I would send these people to the oral surgeon, and they didn't know how to help them resolve their problems, to the orthodontist, to the prosthodontist. I kept thinking all these different specialties were trained to help these people, but they never resolved their issues. And so I started to investigate that further. And you have some successes, you have some failures, but you try to keep that process going so it can be more consistent. And over the years, started to see how breathing was a high correlation with these same chronic pain people. And so that coalesced, that gave me greater awareness. And then I decided at a point that I wanted to limit my practice to this about 25 years ago. I graduated from USC in 1981, so I've been in the field for some time. And so then there wasn't good models. Most of the people back then were general dentists doing this part-time or professors in dental schools. And so I had to create a delivery system. So over the years, as we became successful in doing that, people asked me to start lecturing, presenting information. It evolved to training other people. Then people would come to me and say, well, I want to do what you do. I want to just treat this exclusively. And so we came up with the center concept where these docs are personally mentored by me and trained. And now we have 65 of these offices dispersed throughout 7 countries in the world. So we're throughout the U.S. and Canada, Australia, New Zealand, the U.K., UAE, Dubai, and Bahrain currently. So, and that number just keeps growing because I just came to the realization one day that if I treated patients 7 days a week, 24 hours a day, I'd still only be able to help X number of people. But if I train other people to help others, then we could make a huge impact throughout the world. So that's how it all came to be, and it's still evolving.
Yeah, talk about making an impact. I mean, here's an expert such as yourself who, trying to solve a patient problem, has really built this amazing foundation, if you will, or this amazing group of experts that are helping patients. It's wonderful to hear and inspiring. Doctor, why don't you tell me some problems that practices face when dealing with patients that have this type of pain or dealing with TMJs and sleep in their practices? What do you hear often from dentists, and what's the solution to that problem?
Well, I think the difference is between chronic problems and acute problems. I think most dentists are trained how to handle acute problems. So someone gets hit in the face, or somebody's in a accident of some kind. And so we know that some decompression, anti-inflammatory, some therapy like that usually resolves a lot of these situations. But it's the chronic pain patient that becomes difficult, because if they don't heal from those treatments, then now it's a chronic state, and now it gets more complex. And usually that is the case because there was some underlying problem that person had previous to the injury that's preventing their healing. And that's where it starts to get complicated. And as I said, a lot of these people who develop facial pain issues and jaw problems that did not have a macro trauma, didn't get hit in the face with a baseball bat or a fist or automobile accident, just developed it from repetitive injury, basically micro trauma. There's something inherently wrong that the brain is being stimulated to create arousals that then are going to result in movement disorders. And grinding your teeth at night is a movement disorder. It's in the same category as restless leg and periodic limb movement. So it's a medical condition. And so we as dentists aren't well trained in medical disorders. So we tend to have dental solutions. So we look at teeth. We alter them, we grind on them, equilibration, this sort of thing, but not get resolution. So if dentists are in this situation where they're doing the things that they were trained to do, but they're not getting the results that they hope for, well, then that's where, it gets complicated. And that's where they need to work with someone who has training in both breathing disorders and chronic pain. I'll give you, for instance, I just submitted a paper to the Journal of Orofacial Pain and Headaches. We hope to get published here. 1,400 patients from, I think, about 11 of our centers participate in data collection. We're simply looking at the correlation between nasal obstruction and orofacial pain. And we found that patients with nasal obstruction are 6.97 times more likely to have orofacial pain. Particularly nasal valve. That's, the first point of entry air into your body properly. And if it is pinched together, as many of these patients are, results in mouth breathing, facial pain, and all these kinds of issues. There's people who have collapse of their pharyngeal airways when they're unconscious, so apnea. And so the mandible has to constantly be moved forward in order to open the airway and these issues. So we see respiratory issues being a very big factor in these chronic pain patients, and it can exacerbate an injury. So let's say you had these issues and you're grinding your teeth and you're trying to maintain an airway, and then you get a motor vehicle accident. Now you have injury to your jaw, your neck, and all these different areas are hurting, which is only giving you more arousals at night. Now you're grinding your teeth even more. And so, the therapy to try to get you healed from these things is kind of failing on all ends because you've got to look at the big picture. So that's where things get a little more complicated. Finding people in your dental practice who have breathing disorders, well, that's not too hard because the symptoms are grinding your teeth, periodontal disease, dry mouth, and scalloping of the tongue is 70% predictive. So a lot of the things that people go to the dentist to have treatment for are the signs and symptoms of breathing disorders. And you can always find these people, like the person who you can't tilt back all the way. You know how they start to tilt them back and they say, oh, wait. Oh, that's far enough, doc. Okay, well, that person likely has positional apnea. And they know if they go any further back, they're going to stop breathing. So sure. That person's probably sleeping in a Barca lounger. And those are some of the questions you should ask. Hey, do you sleep upright? Are you being treated for this issue? These are things that you want to look at. And those are the people that crack their teeth. They wake up with teeth cracked and stuff like that because they're struggling to breathe. And you can bite 5 times harder when you're asleep than you can in the daytime. That's why there's so much damage to the jaw, the facial structures, and the teeth while people are unconscious. Because proprioception goes to your cerebellum when you're unconscious, and proprioception goes to your somatic brain. You can stop yourself from clenching your teeth in the daytime, but at nighttime, that's not under your control. So these are all things that a dentist deals with daily. And so it's just about awareness.
It's fascinating. Doctor, I've got a 2-part question for you. they're very related. So it's going to be a very long question, but I'm going to ask it together because I think both your answers to both are going to lead kind of in the same direction. If a general dentist is looking for an expert to help one of his or her patients, right? So they know they have this issue. They know going to a TMJ expert is in the best interest of the patient. They can't treat them themselves. First question is, how do they go about finding that expert? How do you vet to make sure you're sending your patient to someone who is going to provide the highest level of treatment care? Question one. Question two, if you're a general dentist and you know you're not ready now, clearly they don't teach this in dental school, but you're as interested in it and fascinated with it as you yourself are, how do they look and how would they go about finding someone such as yourself to help them with education and training?
Well, so the determination of competency and it's really about philosophy. There's lots of different philosophies on how to treat these disorders. There's symptomatic philosophy where you say, gee, no one can ever really make these people better. So we're going to manage their pain. So we'll give them Botox injections. We'll give them trigger point. We'll give them pills and give them maybe appliances and things like that so that they cover up the symptoms and the person now is becoming more ill as it progresses and the pathology is increasing. So there's that philosophy. Then there's the philosophy that I'm speaking about, which is finding origin. If you can find origin for these different manifestations, then you'll get a cascade of relief from that process. And now chronic pain from other structures, your hip, shoulder, anything, disturbs sleep. So the longer you have pain, the more disturbed sleep you have. The more disturbed your sleep you have, the more pain you have in the daytime. If you have respiratory problems that produce parafunctional activity, that produce pain, that you wake with, now your day is disturbed because of that pain. So in my thought process and my philosophy, if we get to origin and we can find that the respiratory problems are corrected, that we deal with the systemic inflammation from pain, or the precursor of pain is inflammation. So I have four concepts that I teach and that I center around. And so number one is to address inflammation, both locally and systemically. Two is to control the parafunctional activity of the jaw that produces this inflammation. Three is to maintain proper breathing. Proper breathing means nasal breathing, not oral breathing. Nasal breathing is necessary for your immune function. Oral breathing is unfiltered air, and that's where you're going to run into lots of orthopedic and respiratory and cardiovascular issues. Now, the last is nutrition. Those are the four things that we center on. Now, for a dentist to find somebody with the philosophy that I'm speaking to, which is basically looking at all systems functioning in this way, then the only way I could feel comfortable saying that someone actually delivers this care is through our center network. And that's easy to find. A center close to you is to go on our website, which is TMJ Therapy Center, CENTRE.com. And you will be, wherever you're at in the world, you will be directed to the nearest center that then follows these kinds of protocols. And if people have interest in learning these techniques, then I host courses. We call it mini residency. We have one coming up actually in a couple of weeks here in San Diego. The last part of it, we teach a 3-session course on A, diagnosis, how to diagnose, B, how to treat, and C, how to establish long-term resolution of these issues, and how to differentiate some of the more complex problems. So that way you understand that there is a way to handle pretty much any respiratory problem that a person can present with by the dentist in collaboration with the sleep physician, and that you can give significant relief, long-term relief, for these chronic pain issues because there's a lot of people out there suffering. And, the average dental practice is swimming in these patients because they're presenting with oral manifestations of these issues. So you don't have to look far.
Yeah. It's fascinating. Your work is fascinating. What you've completed and or what you've worked towards is just, it's amazing inspiration for sure. I want to direct our audience just one more time to the website. It's TMJ Therapy Centre, CENTRE.com. And we'll go ahead and put it on our website as well. One last thing real quickly. You also have a book that you wrote, Airway Management. Tell us a little bit about that. And also, it looks like you can find it on Amazon. If there's any other place they can grab a copy of the book too. But I'd love to hear just in a minute or less a little bit about your book.
Well, it was a way to summarize what we do in our philosophy and understand why people's health is declining. Right now, we're so concerned about COVID and not understanding where our real natural protection is our nose, because that's where this virus multiplies and then, becomes infected into, our lungs and it creates, death. It's just terrible. And so understanding how a nose works, that's the primary filtration. So air is brought into your nose, it's moistened, it's warmed, and it's filtered before you bring it into your body. You're also combining it with nitric oxide, which is a gas that is concentrated thousands of times into your sinuses. So every nasal breath, you're drawing this gas out of your sinuses and brought into your lungs. And that gas is antimicrobial. So it kills viruses, it kills bacteria, it kills fungus. It causes peripheral vasodilation. So simply breathing through your nose causes your blood pressure to decrease. So it is your immune system. And when that doesn't work, you mouth breathe, and now you're susceptible to anything that's out there. So we're looking at health crisis. So what do we die of? We die of cardiovascular disease. Okay, so what's the mechanism? Oh, you eat too much cholesterol? No, it's arousals. The thing that will kill you at night is how many times you wake up. It's not really the suffocation. It's not really the hypoxia, although those certainly can cause cell death depending on how badly it is. But the mechanism on how you get cardiovascular disease is because every time you struggle to breathe and you have a microarousal, you come from deeper to lighter sleep, you produce cortisol. And cortisol then is pumped through your vascular system and causes oxidative stress. So the blood starts to coagulate. And now you throw a thrombus and you have a heart attack or a stroke, and that's what you're going to die of. And of course, these problems with breathing get worse as you age because we lose collagen and tonus in our airways. So the collapsibility is greater and greater until they say something like, oh, well, he went in his sleep. And that tells you exactly where the issues are. So you get cardiovascular disease from disturbance of sleep. And so that's why it's so important to understand. You want to be a healthy person. You want to have a long life. Well, you need to get good sleep. This sounds silly, but you need to be able to breathe properly day and night. And right. You need to watch what you put in your mouth because that is a huge part of why we're not well. Probably 90% of all, visits to a physician are things that a person produced.
Sure. Yeah, that's very true. And, ironically, when you say that, it's also one of the first question or the first question any physician asks anyone in any type of distress, right? How you breathing? COVID, how you breathing, right? That's exactly.
Well, now, but previous to this, the most vital function of a human being is the least evaluated by any healthcare practitioner prior to COVID. It's the last thing anybody would ask. Okay. I mean, you have to know there's something wrong to bring it to your physician's attention to get evaluated. That's kind of how it has been working. Now we're understanding, hey, this is a big problem. And that was the reason for the book, was to bring light onto these subjects. Yes, thank you.
Glad you wrote it. I'm glad you're on the show. We appreciate you. We want you to come back in anytime. Again, audience, reach out. Just next level and brilliant. We really appreciate you coming on.
Well, thanks, Patrick. Thanks for having me.
You bet. Come back anytime.
Appreciate it.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.